PAH.TV coverage of CHEST 2015 in Montreal. Thomas Baldrick, joined now by Dr. Roxana Sulica from Mount Sinai Hospital in New York. Thanks for spending a couple minutes of your conference with us.
Thank you for having me here.
So let's talk about what you presented here, some cases that you presented here at CHEST.
Yes, so we presented cases of sarcoidosis and pulmonary hypertension. These are very complex patients. The pathogenesis of pulmonary hypertension in sarcoid is truly complex. We have presented a case from the moment of presentation to the decision of treatment and the results of the treatment.
How common is PH in patients with sarcoidosis?
So this is group 5 pulmonary hypertension, and it depends on what kind of population you are looking at. If you are looking at sarcoid clinics, so patients that come to you, it's probably around 8% teens or so. But if you look at patients with advanced sarcoidosis that are evaluated for lung transplantation, it can go up to 50-60% and even above, depending on the series where they looked at.
It's kind of a loaded question, but how do you treat these patients?
It's loaded because technically we have nothing that is FDA approved. We do have a couple of case series, and I think things are happening, studies are happening. We are looking at probably even including them in guidelines in the near future. And it very much depends on the type of the patient. How significant is the pulmonary hypertension, and particularly how significant is the right ventricular failure? That would be something that will decide the type of treatment that you use. We have prostacyclin use in these people that have advanced right heart failure, and we have a case series from Marty Gomberg in Chicago that shows that it's great success with using subcutaneous or IV prostacyclins. We have older data from Boston, from Hap-Farber, with use of prostacyclin, and we have a series, either prospective or retrospective data in which they use non-prostacyclin, so the usual pills that we have, or in inhaled medication.
So how do you feel these options are?
They are certainly patients that respond to therapy. We have a bosentan, it's actually the only placebo-controlled randomized trial that we have, double-blind randomized trial. So people do respond both hemodynamically and by clinical improvement, exercise capacity, functional class, and so forth. We haven't had any significant safety issues that were identified, but again, we have to take this with a grain of salt because we're talking about case series, cohort studies, and so forth.
Thank you, Doctor. Appreciate your time sharing your work.
Thank you. My pleasure.